Hello, my name's Pritchard. I'm a registered respiratory therapist and patient care coordinator with Biomed. Today I want to talk to you about our cost analysis and mortality rate study regarding the use of NIV therapy for patients with COPD and chronic respiratory failure. This study, performed by an independent consulting company, KPMG, was completed using 5% of random Medicare data claims between 2013 and 2016 and is the largest ever performed examining the use of NIV therapy with over 15,600 patients involved. These patients were split into 5 different groups. Our COPD chronic respiratory failure patients that were untreated at 14,230. Our COPD chronic respiratory failure patients that were treated with NIV therapy from other vent suppliers at 1,266. Our COPD chronic respiratory failure patients that were treated with BiPAP at 89. Our COPD chronic respiratory failure patients that were treated with NIV therapy from Biomed at 112. And our COPD chronic respiratory failure patients treated by all vent suppliers combined at 1,378. For all of these patients treated with NIV therapy, there is a 7% mortality rate reduction within the first week compared to untreated patients, and a 16% reduction in mortality rate after 6 weeks that is persistent for the following 6 months after being placed on the vent, giving us a 42% relative reduction in mortality rate and leaving our number needed to save a life at 1 in 6. This number compared to other successful drugs like Lipitor, which requires 71 patients to prevent 1 heart attack. Our cost analysis study over 1 year shows that NIV therapy NIV treatment with Biomed is $25,000 cheaper than the cost of an untreated patient, $16,000 cheaper than our competition, and $14,000 cheaper than treating these patients with regular BiPAP. These savings on healthcare costs are accomplished by the decrease in hospital readmissions from inpatient spending on Medicare Part A. Obviously, the untreated group has the highest inpatient spending, but what is most surprising is that the study shows a 32% increase in inpatient spending for patients treated with BiPAP and a 6% reduction in inpatient spending for all patients treated with NIV therapy. So our key findings in this study are that patients treated with NIV therapy from Biomed have the lowest total healthcare costs compared to all other patient groups. The untreated population has the highest mortality rate. Patients who receive NIV therapy reduces mortality by 42% after the first 6 months of use, and patients who were treated with BiPAP are more expensive due to the increase in Medicare Part A spending.